Open wound first aid. An open wound is a type of an injury that causes an external or internal break in the body's tissue. It is commonly caused by accidents involving sharp or rough objects that cut through the skin and may leave some form of trauma. If left alone, it exposes the body to harmful bacteria, making it at risk of infection. And in this video, we will show you how to treat open wounds. Laceration wound. A laceration cut refers to a skin wound. Unlike aberration, none of the skin is missing. A cut is typically thought of a wound caused by a sharp object, like a shard of glass. Lacerations tend to be caused by blunt trauma.
Sa laceration wounds, ito po yung gagawin nyo. First, lalagyan nyo po ng cloth para makontrol yung pagdurugo or bleeding. Then, syempre lalagyan nyo ng pressure yung sugat. Then, elevate nyo yung kung saan man yung banda yung sugat ng patient. Then, after nyo makontrol yung durugo ng sugat, tatanggalin nyo ulit yung cloth. Lagyan na natin siya ng betadine para may cleanse siya. After malagyan ng antiseptic at malinis na yung sugat, maglalagay na tayo ng gaza or whatever na pantakip dito sa sugat na to. Yan. Then, kapag dumikit na yon, lagyan ulit natin ng kahit anong kulot. Basta malagyan lang ng pressure ulit yung sugat. Yun lang.
Puncture wound. A puncture is a wound made by a pointed object such as a nail, knife, or a sharp tooth. Puncture wounds often appear to be on the surface but may extend into the deeper tissue layers. Stitches are primarily used if the cut is more than a quarter inch deep, is on the face, or reaches the bone.
Ang una natin gagawin dito sa puncture wound, kailangan din natin siya tatanggalin kasi maaaring mag-loose yung ganyan. Pero kailangan natin siyang hugasan and then sabunin. Kailangan natin hugasan ang kanyang sugat gamit ang tubig and then sabon para hindi siya ma-infection. Lalagyan natin ng antiseptic. Tapos, lalagyan natin siya ng benda para hindi magalaw ang nakatusok sa sugat. Dadalhin natin siya sa pinakamalapit na clinic para tanggal ang nakatusok sa sugat. Tara na.
Burn. Burns are a type of painful wounds caused by thermal, electrical, chemical, or electromagnetic energy. Smoking and open flames are the leading causes of burn injury for older adults, while scalding is the leading cause of injury for children.
Ito yung first degree burn wounds. Pag may ganito kayo, kailangan yung ibabad muna siya sa running water na 10 minutes. After mababad ng 10 minutes, mag-a-apply tayo ngayon ng wet cloth. Then, ibabalot natin siya. After ma-apply yung wet cloth, pupunasan muna natin and then a-apply tayo ng lotion. Dahan-dahan lang kasi baka maaning burn. Pagkatapos naman nun, talagyan na ng bandage.
Avulsion wound. An avulsion is a partial or complete tearing away of the skin and the tissue beneath. Avulsions usually occur during violent accidents such as explosions, gunshots, and body-crushing incidents. These types of wounds bleed heavily and rapidly.
So sa avulsion po, lalagyan po natin ng absorbent cloth ng first layer ang kanyang sugat. So ganyan po, para po tumigil ang kanyang pagdurugo at mabawasan. Pangalawa po, papatungan pa ulit po siya natin ng isa pang absorbent cloth. Pagkatapos patungan ng isa pang absorbent cloth, ibigyan natin po siya ng pressure para tumigil po yung kanyang pagdurugo at makontrol. So pangatlo po, tatanggalin po natin siya dahan-dahan at saka lalagyan po natin siya ng betadine para sa kanyang treatment. Para po sa paglalagay po natin ng betadine, hindi po may infection ng kanyang sugat. Kasi po malaki po yung sugat. Pagkatapos po, babalik po natin yung cloth na ginamit po natin. Tapos po, iaangat po natin yung kanyang kamay. Yun lang po. Thank you.
Doctor's ABC. Doctor's ABC is a 6-step first aid process focused on handling any emergency situation confidently and calmly. Doctor's ABC is also a short but powerful acronym designed to help you. D is for danger. You're the most important person in any emergency situation. Before jumping into action, you should check if there are any actual or potential dangers to yourself, the bystanders, or the patient. If danger is present, you should attempt to reduce the risk of harm. If you access the situation as being too dangerous, then stay back and call for professional help. R is for response. If someone collapses or is unwell, your first action is to check for a response. Do this in adults by shouting at them and gently shaking their shoulders. Do not shake the person violently, as this could cause further harm. If you do not get any response, then the victim is unconscious, and this is a medical emergency. S is for shout for help. Once you've found someone unconscious, your first action is to shout for help. Making people aware of an emergency situation is important. The bystanders can perform useful jobs such as flagging down an ambulance. A is for airway. Every unconscious patient is at risk of airway obstruction due to the back of the tongue falling back. B is for breathing. Once you've opened the airway, you should check for breathing for a maximum of 10 seconds. Place the side of your face over the victim's mouth and look at the chest. You're looking at the chest's movement, listening for breathing sounds and feeling for exhaled breath on the side of your cheek. And lastly, C is for CPR. If someone isn't breathing, you should immediately start cardiopulmonary resuscitation and call for a defibrillator. CPR comprises of chest compressions and rescue breaths. Chest compressions should be started as soon as possible at the rate of 100/20 per minute.